Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us on WHAR. I'm Kyle Wiggs, and we've got three guests with us. We've got Dr. Christine Wilson and Dr. John Sunyecz. I believe they're in the same room together. And
yes,
Doctor, good morning. Thanks for coming on. We appreciate it.
Good morning.
Good morning.
And we also have Dr. Jaschar Shakuri-Rad. He is with us as well. And Dr. Rad, good morning.
Good morning. Thanks for having us.
Thank you for coming on. And, of course, Dr. Rad's many times has been on this program, and we appreciate you coming back. Okay, so we're going to focus today on Axonics Therapy for bladder and bowel incontinence. So let's get into that. First of all, let's define what we're talking about when you start with an overactive bladder. Let's start there. Let's kind of define that and some of the symptoms and what some of your patients are dealing with. Who wants to take that one first?
All right, I'll do the definition perhaps,
okay.
Kyle. So, overactive bladder is a condition that a lot of folks in the U.S. experience. The incidence of it is pretty high, about 12 to 16% of adults in the U.S. That's about 33 million people have this condition. And the prevalence goes up with age. And people that are over 65, for example, 30 to 40% of them experience this. That's about 1 in 6 adults experience overactive bladder symptoms at some point in their lifetime. Now, it's a condition where you feel the sudden urge that you have to go to the restroom, but you don't make it sometimes in time, and you may have an incontinence episode. You lose control of your urinary function. This obviously creates a lot of issues for folks, and can lead to societal issues, can lead to social issues. We also look at bowel incontinence as another condition that this therapy helps with. And bowel incontinence is also fairly common, less common than urinary incontinence, but about 8% of adults in the U.S. report fecal incontinence at least monthly. And nursing home patients, actually, the prevalence goes up to 40 to 50%. And the last condition that this therapy helps is urinary retention. That's the inability to empty the bladder. And urinary retention occurs often in a hospital setting. We see this quite frequently, but it occurs, in the general population at about 2 per 1,000 men per year. A little bit less common in women.
Mm-hmm. With the urinary retention, how much of that is linked to prostate issues?
Quite a bit of it is actually related to the prostate. That's why the prevalence in women is less, because women don't have a prostate gland. In guys, the prostate gland can grow and cause blockage and obstruction, and over time, patients experience decreased urinary stream, urinary urgency, frequency type symptoms. But it may also be related to the bladder itself, where the bladder, which is a muscle, stops functioning, stops contracting or squeezing. And when that occurs, that's called non-obstructive urinary retention, and that's what Axonics is designed to help.
Okay, let's get into the Axonics part of it. First of all, we can turn to Dr. Wilson or Dr. Sunyecz. Is this something new, or is this a technology or a practice that's kind of evolved recently?
Yeah, the technology's been around since the 1990s, but Axonics is a company that really took the technology and advanced it to the point where it's much more user-friendly, if you will, from a patient standpoint. The device itself is very small. It's fairly straightforward to insert. And has really good data as far as the effectiveness. I mean, once patients have the therapy placed and tested, over 90% of the people have significant improvement and show satisfaction with the technology compared to some of the older technology that was available.
Mm-hmm. How exactly does it work?
Well, the Axonics device is a small implantable device that gets placed right under the skin, and there are basically leads that go from that to the nerves that control the bowel and bladder function. And so it's a general electrical stimulation to those nerves that restores the communication between the brain and the pelvic organs.
Okay, so it works in both regards, right? It works for, we talked about bladder retention, the inability to empty the bladder, and we also talked about overactive bladder and overactive bowel. So it kind of works both ways, so to speak?
Right. The sacral nerve, usually ideally S3, which is the sacral nerve coming off the spinal cord, or is the nerve that usually goes to the bowel and bladder. So it's basically improving the communication between the sacral nerve and the brain.
Okay, and Dr. Rad, this is available for patients who have these symptoms?
Yes. So, the Axonics device is indicated for those three conditions, but we don't go straight to that treatment as a first line. There are a lot of steps that patients have to go through to make sure that this is really going to be the most effective way to treat them. We have a lot of non-medical types of treatments. This includes things like bladder therapies, pelvic floor physical therapies, fluid and diet management. And then we have, if those things don't work, then we have medications, multiple different classes and different medications we try. And then we move them down to what we call advanced therapies and sacral neuromodulation, which Axonics is part of that group, is then a kind of a third-line treatment, we call it. Once patients get to that point, then their chance of actually having response and being able to get benefit from this increases quite a bit.
Okay, you gave us, you gave us the statistics about the percentage of people that suffer from these conditions, but a lot of times they go undiagnosed because, quite frankly, they're kind of embarrassing. So what would you say, Dr. Sunyecz, what would you say to someone out there who's kind of suffering quietly through this and they just don't want to deal with it? They're kind of covering it up. So there's help, right? There's things that you can do.
Absolutely, Kyle. In our practice, we see patients, and they have a much easier time talking about urinary issues. I think Dr. Wilson would probably agree. We oftentimes will, talk about leaking and difficulty with the social stigma that goes along with leaking and afraid of having an accident if they go shopping or go out to dinner at a restaurant, and so that sometimes can really limit what their enjoyment is. And we know that medications are not the end all be all. If they've tried the second line therapy, as Dr. Rad was alluding to, about a third, 30 to 40% of those patients don't really adequately respond to the medications for an overactive bladder. The thing that's been striking to me over time is how few of our patients don't talk about the bowel issues. And a lot of these patients have dual incontinence, where they will have urinary leaking, but then they also have stool leaking and accidents, and that's much less commonly talked about. So I would just encourage patients to be open with your physicians and talk to them, and also for us as physicians to make sure we don't forget to ask those important questions when we're meeting with patients. Yeah,
talk about it. There's ways that you can get help, and certainly no one should have to go through that. There's certain ways to alleviate these symptoms. This is Mon Health Talk. We're going to take a quick break here. We are with Dr. Jaschar Shakuri-Rad, with Dr. Christine Wilson, Dr. John Sunyecz. We're talking about bladder incontinence and retention and Axonics, recent developments there that perhaps could be the answer for you if you're suffering through these things. And we'll get into that treatment and that therapy a little bit more in depth when we return. Stay with us. Mon Health Talk for this Monday.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us. And we have Doctors Jaschar Shakuri-Rad with us, Dr. Christine Wilson, Dr. John Sunyecz, and we talked in the first segment about these issues: overactive bladder, urinary retention, bowel incontinence. Those things that are they're a problem for many people, and the doctors established that there's kind of a way to deal with these things. You kind of start perhaps with some pelvic health physical therapy. There's medication that can help you deal with these things. There's also Axonics Therapy for these issues. So that's what we're going to get into here during this segment, first of all. So, Dr. Rad, let's restart with you. You described the procedure, what it's like. What results have you seen so far with the patients who have more recently undergone this procedure?
Yeah, so the results are actually quite good, Kyle. Because we have a pathway in place, we don't just offer this to all patients coming in. We identify patients that really can benefit from it. And when you go through this carefully thought out pathway, then you really maximize the number of patients that can benefit from this. And in our study, in our data, we see about 80 to 85% of patients respond very well to this therapy. And I always say to patients, this is a quality of life type of treatment. I do a lot of oncology as well, and we do extend quantity of life, but we have to focus on quality as well, because that's your day-to-day. You want to go to church, you want to go to the grocery store, as Dr. Sunyecz mentioned, you want to be out and about. And if you are not doing that because you have a medical problem, because you have an embarrassing problem like incontinence, then definitely come and seek help, because the results are great. And Axonics, again, is part of our pathway, and at Mon Health, we offer all of the treatments, and so you can take advantage of whatever works for you individually.
Okay, Dr. Sunyecz, again, the urinary issues are one thing, but the patients that have the bowel symptoms, what sort of improvements have you seen with them?
Yeah, Kyle, I think, I think that the thing that's most striking to me is when we are treating these patients for their urinary issues, and I see them back at their postoperative visit, and they're fortunately usually very happy with the results urinary-wise. How many of those people also mentioned that they had improvement from a bowel standpoint, and they were just too embarrassed to talk about it? So quality of life for both bladder and bowel function is commonly seen, and it definitely can be a quality of life improvement for these patients. Okay,
let's get into the procedure itself. Dr. Wilson, take us through the steps to have this device surgically implanted. How does it work? What's the process?
Sure. So with Axonics, the first thing that's done is an in-office trial. It's called a peripheral nerve evaluation, a P&E, where the leads are placed in the office, and the patient's device is taped to their back, and they wear it through the weekend for 48 hours, and then if they have a good response, then they're identified as a candidate who would be a good candidate to have the actual implant placed, and that's done in the hospital. It's a minimally invasive outpatient procedure where a small incision is made near the lower back, buttock area, and the device is placed under the skin. It's a fairly quick procedure, takes about 45 minutes to an hour, and then they're typically able to go home.
Okay, and you live a normal. Well, you get back to close to living a normal life, right? Dr. Rad, how long does it take for the patients to recover from the procedure and get the feeling like nothing ever happened, like it's it's part of them now?
Yeah, I think the actual incision, like Dr. Wilson mentioned, is very small, about 2 inches or so, and this incision is on the back side, kind of above the buttocks area. The patients, we recommend that they don't do heavy lifting or engage in activities such as getting on a riding lawnmower, driving on a side-by-side, horseback riding, things of that nature, for about a couple of weeks. But their day-to-day activities are restored fairly quickly. The day after the operation, I tell them you can drive, you can go grocery shopping, you can engage in light lifting activities. And the therapy itself is activated immediately in the postoperative area, so they should start noticing improvement in their symptoms right away. And that improvement actually does continue to improve over time as well. So if you get 60% improvement right after surgery, a couple of weeks after it may be 70% and then 80% and then go up from there. The goal is always to get at the very least 50 to 60% improvement from this procedure alone. Some patients get 100%, some patients may get 50 to 60%, and then there's and everything in between.
Does it increase over time? It'll start at 50, say start at 50% and then get better? Is that possible? Have you seen that?
Yes, typically we do see improvement over time, and this is actually more pronounced in patients who have urinary retention, patients who are unable to empty their bladder. They may initially have a slower response where they're emptying some of their bladder, and then over time, usually within about 6 months to 9 months, they get to a point where they're just having normal bladder function.
Okay. Move back to Dr. Sunyecz. How long does this last? Is this a lifetime thing? Does it have an issue where you might have to undergo this procedure again in the future?
Yes, the device, and that's part of what's the nice thing about Axonics is that the current device is the one that most patients have placed, lasts 15 to 20 years. And so long-lasting, patients have it placed in the operating room, and they don't have to worry about recharging or doing anything from a battery standpoint for 15 to 20 years. At that time, yes, there'd be a small incision where the old incision was, the battery or the device would be removed and a new one would be inserted. So it's a much quicker procedure at that point and at that 15 to 20 year mark. But patients really like the fact that they don't have to worry about charging a device or charging the battery of the device on a monthly basis or every 3 month type basis. It's, once again, placed and out of sight, out of mind for 15 to 20 years.
Okay, and we're told this is MRI safe, right? They don't have to worry about removing it when they undergo an MRI or that type of procedure?
That's correct. They just have to turn the device off. They're given a little remote control, so they're able to turn it off and turn it on at will. They're also able to adjust the intensity, if you will, of the device if they need to. So the patients also like that they can manipulate if they need to. They can turn it off if they'd like to for an MRI. But most people just don't use a device or that remote unless they absolutely need to shut it off for, like I said, like an MRI.
Mm-hmm. Dr. Wilson, who would be an ideal candidate for this?
Basically, any adult who has overactive bladder, urge incontinence, which is the leakage that comes from overactive bladder, bowel incontinence, and urinary retention. Ideally, it's someone who has gone through the steps and has failed lifestyle modifications and not gotten relief or had side effects with the medications. One of the other big issues we've seen is a lot of the incontinence medications currently on the market are just cost prohibitive for patients. And so once they've gone through the steps and have not gotten the outcome that they needed, then they are good candidates to consider this. Certain patients aren't going to be ideal candidates, patients who have certain medical conditions, so they would need to be evaluated first. But it's very open to almost everybody.
Mm-hmm. All right. Well, before we wrap up here, I'd like to give each of you a chance to say something about or say something to someone who's out there listening and they're having these problems and they're embarrassed. They just don't want to deal with it. What would you say to them about getting help? And Dr. Rad, like you said, it's a quality of life issue for a lot of people, and there is help for people who have these symptoms.
Yes, I would say, don't let the social stigma control your life. This is a medical issue, just like high blood pressure is a medical issue, high cholesterol is a medical issue. You go to your physician, talk about those things. and are put on appropriate therapy. And this is no different. Just talking can really lead to you understanding the disease process and understanding the treatment options, and ultimately, hopefully, we'll have a resolution of your chronic daily issues and can get back to normal life.
Mm-hmm. Dr. Wilson, what would you say to encourage someone?
Well, I would probably tell patients that not to be embarrassed. Everybody thinks that they're alone dealing with this, but it is so common. We see it all the time. We've started using a survey in our office with all of our annuals, and it's been pretty surprising how many people haven't talked about it or put it on our initial intake, but on the survey, they have pretty significant incontinence. It's just so common.
Yeah. I mean, and there's so many reasons why, too, right? Pregnancy, people that have had issues with, men who have prostate issues, people that have had surgical procedures. So, I mean, there's a lot out there, right, Dr. Sunyecz? People that could be helped by this.
Exactly. Yeah, it's a very common issue. So, as Dr. Wilson, Dr. Rad mentioned, you're not alone as a patient. Talk to your physician, talk to your healthcare provider, make it known, and if as long as you have that open dialogue, there are effective long-term treatments. Axonics being one of them, and I think it goes. That's the first step, is just being open with your healthcare provider.
Okay, and I'll give out a few numbers here. Mon Health Urology in Morgantown, that's where Dr. Rad is located, 304-599-3074. Again, Mon Health Urology, 304-599-3074. Doctors Wilson and Dr. Sunyecz, where are you located?
We are in Hopwood, which is outside of Uniontown, Pennsylvania.
Okay, so let me give that number out as well, 724-437-2147. That's Mon Health Gynecology in Hopwood. It's just right up the road on the toll road up there. 724-437-2147. All right, we got about a minute left. Do you have anything to add? Anything you'd like to say before we wrap this up?
I think I'd like to always remind folks out there that, if you have a medical condition, Mon Health has many, if not all of the options available for folks, and we focus on patient care, high technology, high touch, meaning we have the best treatments, we have the best physicians and healthcare providers, and we are very, very community focused, and hope to be able to take care of folks soon.
All right, very good. Anything else?
I would just mirror that. The reason that Dr. Wilson and I are with Mon is the patient-centered care that we can provide to patients.
Yeah, our patients up here in Uniontown who have gone down to Mon when we do our procedures down there, 100% of them are so impressed with the facility and just the care and just the homey feel that they experience when they are in the Mon facility.
Yeah, absolutely. Well, very good. We appreciate your time, all of you. Thanks again, and this was great information, and we sincerely hope it can help somebody out there. Thank you very much.
Thank you.
Thank you.
That is Mon Health Talk for this Monday. Doctors Jaschar Shakuri-Rad, Christine Wilson, and John Sunyecz. Again, Mon Health Talk for this Monday. Thanks for listening here on WAJR.